Coming up today, picking a name for your baby can be overwhelming, and quite honestly, it's a lot of pressure. So how do you choose? We meet the local mom with a special tribute to the doctor who helped save her life. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Kaleigh Hobbs was a young mother when she noticed she had a mass on her neck and her baby girl was just 8 weeks old. Doctors diagnosed Kaleigh with Hodgkin's lymphoma. There is no screening for this type of cancer, but thankfully Kaleigh noticed the mass and knew something was wrong. The most common symptoms of Hodgkin's lymphoma is swelling in your lymph nodes. It often feels like a painless lump in the neck, armpit, or groin. Kaleigh, who lives in Ottawa, Kansas, came to the University of Kansas Cancer Center where she met with Abdul Rahim Yacoub. Kaleigh is here with us today, along with her oncologist and hematologist, Dr. Yacoub. How are you both doing?
Good morning, Jessica. I'm doing great.
Good to see you from this side of the table. What's it like to see each other?
It's wonderful.
It's always great to see each other.
I love this. Okay,
Kaleigh is my patient and now become a family and a personal friend.
Yes, yes. And we're going to hear all about it today. Take a look inside your relationship and your care, Kaleigh, that you had. So how did you notice this mass? Tell us about that.
So I was 8 weeks postpartum with my daughter Bryn. My body obviously was going through drastic changes, but I had just noticed some swelling above my left collarbone one evening, looking in the mirror, and thought to myself, this just doesn't seem right, does not seem to be on track with what I should be experiencing postpartum.
Did it hurt, or you just kind of, I mean,
No.
you know how after we have babies, we're always just
Right. I had
weird
no
things happen.
pain.
You're feeling all sorts of parts of your body.
I had no pain in any of those areas.
But you knew that lump
I knew
was
something
not
was
there.
wrong.
Shouldn't-
I'm a nurse
shouldn't be there.
myself and just knew something was up.
So how long did this go on until you realized you needed to get to a doctor?
Well, being a nurse, that was
Yes.
my first week back to work postpartum, actually. And so I went to one of the pediatricians that I worked for, and I said, what is this? And she immediately was very concerned. We went through a long list of things that could possibly be causing swollen lymph nodes, and I ended up having an appointment with her primary care physician that afternoon. So we did some preliminary lab work and imaging, and then had a biopsy that same week.
And what are you
Ended up
told?
here.
And then what were you told at that moment?
That her suspicion was Hodgkin's lymphoma,
And
or
that's-
a type of lymphoma.
And that's what you were diagnosed with then. And
Correct.
you're told this, and you have this little girl at home who needs a really strong, healthy mom. What was that like for you?
It was very scary and eye-opening, but having her at home, you know, being so little and just new to motherhood, she was my biggest cheerleader, obviously,
Yeah.
and I just knew whatever it was, we had to take it on.
Dr.
Yeah, just-
Yacoub, when you meet Kaleigh, how did you tackle this head on?
I was very proud of Kaleigh's attitude towards this. And she noticed a problem, she immediately got care, she immediately got answers, and she wasted no time. She immediately made an appointment, and as soon as she learned about her diagnosis and her cancer, and then she came in with just really ready to hear and talk and get action. And that's really our first visit. And we were absolutely going over a list of all the things we have to do ASAP on the spot.
And you know, what type of treatment considerations and challenges are there for young cancer patients?
Oh, so many, because we absolutely want cure. And this is unnegotiable. We want, and for a patient with that diagnosis with Hodgkin's lymphoma, we're not going to negotiate not getting to a cure. But we also do not want to get to that at any cost. We also want to make sure that we achieve a cure with enough treatment, not too much, not treatments that would cause lasting side effects or complications. We want the maximum treatment that gets the job done and gets her cured. At the same token, chemotherapy has side effects and radiation and all of that were things we've considered. And we wanted to balance those toxicities and side effects and complications that can affect Kaleigh's future, and we address all of that. So fertility preservation, risk of second cancer, so chemotherapy and radiation can cause second cancer, second problems long term, and we need to minimize and address that all at the beginning. And also Kaleigh was brave enough to sign up for a clinical trial. And that was a very brave move for when with so many moving parts at the time. I know she was not eventually enrolled in that study, but she had the guts to register and volunteer to be a study candidate.
And how important is that to make sure that patients know about clinical trials?
Absolutely, very important. And actually, that study she signed up for came back positive, and it actually changed the standard of care. So we now treat patients according to that study. So that study was a very important, pivotal study and a milestone for Hodgkin's lymphoma.
So Kayleigh goes through rounds of chemo. Is that the typical treatment plan for somebody with her type of lymphoma?
Yeah, so Kayleigh's plan has evolved ever since we've met. We've had multiple tumor boards, we've had second opinions, we've actually involved all the KU team. We had multiple oncologists and radiation oncologists, and all of them had a say and weighed in counseling me and counseling Kayleigh on what is the best course of action. So we started initially with a plan of maybe chemotherapy and radiation, but as we went through the treatments and the scans, we had good counseling from the radiation oncologist that this might not be necessarily the right course of action, and we finished the treatment with chemotherapy only.
And you certainly took it in stride. And you have some photos to show us because it was really like a family affair. You were literally counting down or counting up to when this was going to be over. And so what was it like? Just the support you had, you have a smile on your face, not easy to do. What was it like?
It was obviously life-changing, but just having the support that we had was the biggest blessing. I knew I had to have that positive attitude just because of the baby and for my family and my friends and my job, and having their support made it that much better. I knew that if I felt down on myself that I was not going to feel well, and I was not going to do as well through treatments. And so just trying to stay positive the whole time was
for baby
exactly
Bryn,
what
right?
I did. For Bryn.
For Bryn. She was your cheerleader right there the whole time. I want to show some PET scans because this is what kind of just gives us an idea of what you're looking at. And what are we seeing here on the left versus on the right?
Yeah, so again, this is one of the images that shows the cancer before and after treatment. So this scan is called a PET-CT scan. It uses sugar as a dye, radioactive sugar, and the more red the tissue is the more likely it's cancer. And at the end of the day, we want no red on the scan. So that was the goal. So as you can notice on the left side of the screen, all these red masses were cancer masses, lymph nodes, and part of the cancer that we wanted to eliminate. And that was, and then there's other images that show lymph nodes even further down under the diaphragm and so forth. So we've had some concerning location of the cancer, and it's pretty sizable at the beginning. And then I always had the patient take a snapshot of that photo at the beginning, so that you need to know your enemy. That's the enemy.
Know the enemy.
And then,
I like that.
And then the second scan was the graduation scan when we had all clear. So that's always good to see the before and after.
And so how long did Kayleigh undergo treatment before she was officially into remission?
So here, the first PET-CT scan that was done after 4 treatments or 2 cycles was negative for that stage. That's the first milestone. And the last scan would be, the end of therapy scan would be after 6 full cycles or 12 treatments.
And what causes her kind of cancer so that people listening know what to look for and know the questions to ask?
Yeah, so lymphomas in general are not diseases that are related to certain behavior or environment. There's been association with viruses and radiation exposure and certain exposure in the environment, but it is most likely these are cancers that occur without known causes or known environmental causes, and there's no screening for that, no preventative measures. There's very limited counseling we can do to her family members about what to not do and what to do. So it's one of those events that is hard to predict.
Know your body, feel your body, and know to get help.
Our advice is always you have to maintain insurance, You have to maintain your primary care relationship, and you always have to be aware. Self-awareness is very important.
Absolutely, that's where you find out what you got. So I want to get to the good part because, which is how we discovered your story and how you two have connected through the years. And so so Kayleigh, you have this baby girl, Bryn. You're a young mom. The possibility of having more kids is out there. What kind of conversations are you two having when that starts to seep in?
Right. When I first got my diagnosis and we knew that chemo was going to be starting fairly soon, we had the discussion about fertility preservation and deciding if we wanted to go through with that, knowing that it would push chemo out a little ways, prolong the time in between then and starting. And my husband Justin and I had just decided, we had Bryn at home. She was 8 weeks old. We were blessed with her, and if we were meant to have more babies, we would one day. And so we just decided to start chemo right away and say our prayers for later, basically.
So then what happens when you find out your mother has the BRCA gene,
right,
which makes you at higher risk for ovarian cancer and breast cancer? So then you get tested.
Right.
Tell us about that.
This was post-Hodgkin's. I found out that I had the BRCA2 gene mutation, and as Dr. Yakub can explain, we waited 2 full years after chemo to try, actually to have the go-ahead to try to have another baby. That 2 years is what would consider me in remission. And so during that time, I decided to go ahead and do the prophylactic double mastectomy and reconstruction with plans of a total hysterectomy in the future, just to go ahead and reduce more cancer risk for myself.
So Dr. Yakub, you become now you're in the business of family planning.
Yes, that was a curveball there.
You're expanding your knowledge. And so now you have a boy. So you do get pregnant. How exciting was that for you to add to your family during everything that you've been going through?
The best surprise. It was not a surprise, but the best surprise knowing that we could have another baby.
That was the best news for a lot of people, actually.
Right. I bet. You're every 6 months, doctor, he would give me goals, and I saw him in August, and my goal for February was cancer-free and pregnant, and there we were.
And there we were. The goal has been met. The enemy beaten. So I could tell you, Kayleigh, one of those big pressures I remember having to I thought picking a name for my baby would be fun. It was so much pressure.
Right.
To name an entire human being for the rest of their life was more pressure than I had anticipated. But Dr. Yakub comes in with this genius idea. Please tell us.
Yeah, I gave her the gift of my name. You can use my name, and I translated my name to English and explained the meaning of those words, and she picked one of them.
Right. So he was kind of joking, but kind of serious.
So you tell us the real story. How did this go down?
When I showed up there and obviously was pregnant very early in the pregnancy, and he said, well, I saved your life. I should get to name your baby. And I was like, okay. And he said, no. Yakub in Arabic is Jacob. And so Justin and I went home, and I was like, if this baby's a boy, he's Jacob. That's it. And we did not find out the gender. So at Jacob's birth, it was amazing.
It was
to know
that to be. And what's that like for you?
It's amazing. Yeah, I'm just having a few tears.
I know you
I'm having a few tears as we speak, and this is fantastic. And it's so gratifying that someone looks up to you and names their child after you. It's just the best feeling in the world.
Well, the pictures of little Jacob looking up at big Jacob. And you said, Kayleigh, what happens when you bring Jacob into the clinic space? What does he say?
My son, Yakub.
My son, Yakub. I love this.
He's had a few tours around the cancer center, and the nurses know him as baby Yakub.
Yeah, he's famous. He's a celebrity in the cancer center.
Is he? Okay, well, guess what? We get to meet that celebrity, little Jacob, his sister Bryn. We get to meet Justin here in just a few moments. So wipe your tears and get ready, because they're coming after you. So be sure to ask your questions for all of us here on the panel. You can use the chat on YouTube or Facebook. You can tweet us or email us at the Medical News Network. The info is there on your screen. All right, let's get to our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. I know another cute baby you're going to have to follow later.
I know. I'm sure most people would just rather have me just put the baby up here on the desk.
I know, right? I bet that baby will be, doing some sort of COVID count or some sort of future doctor.
Yeah, definitely. So right now in the hospital we have 30 total infections. but only 12 of those are active. Unfortunately, we do have some severe illness with 2 of those 12 active infections in the ICU and none on the ventilator.
All right, so Doc Ock, we knew this was coming. So starting Thursday, COVID will no longer be a public health emergency in the United States.
Yeah.
Now, separately, the World Health Organization declared the emergency is over on a global scale. So the emergency phase is technically over, both globally and here in the U.S., but the pandemic, as you always say, is not over. And I know Dr. Stites and you are going to go over more of this in detail tomorrow on open mics, but what does it mean to be in a non-emergency pandemic?
Yeah, so on the global scale from the World Health Organization comments, we have to understand that now we are really focusing on those local areas, those countries, but also those local communities within those countries to be prepared and to understand how to live with the disease. Obviously, every country's experience is different than the other countries. For the United States, here, locally and in our communities, again, for some time it hasn't really affected most people's day-to-day lives. That is a good thing, but we also have to understand and not be myopic to the fact that there are certain populations of people who are still very much affected by this. So really the end of the emergency phase is really about a reduction in some of the resources, but also of things, of the flexible things that were allowed hospitals, that were allowed by the government for hospitals to do, such as, creating temporary hospitals in tents outside of their buildings. But for the most part, it really is not going to affect most people's day-to-day lives. We know that there still are stockpiles of vaccines for those that want it, although unfortunately, we have just seen a suboptimal uptake of those booster vaccines since they were since they were available last fall. But again, in general, it's going to be just a change in the overall resources or where some of the funding goes. But for the most part, day-to-day lives for people around the country and in most of our communities are not going to change.
Any reporters with us today? All right, let's get to our community questions. Ed Yen wants to know, could a bone marrow transplant be used to treat Hodgkin's lymphoma?
Yeah, so for patients who have been unfortunate and they did not achieve their goals with the first-line therapy, an autologous stem cell transplantation could be a consideration for relapse refractory disease.
Does chemo usually knock it out?
So that's a good question. So the odds of cure is very high with first-line therapy and with subsequent lines of therapy. So most patients do not need to get to that point, but once we get to having to treat patients after they've failed first-line therapy, an autologous transplant is a consideration, yes.
Mark wants to know, what's the average age of a patient to get this type?
Yeah, and that's also a good question because there's actually 2 peaks in life. There's a peak in young age, Kayleigh being the stereotypical age presentation for that. And then there's also a second peak in the late 50s, early 60s. Also in a second peak for Hodgkin's lymphoma.
So what's her long-term care? What are you, I mean, I know you want to keep seeing Kayleigh in the family,
Yes.
but are you ever going to just let her go, or will she always be coming back to see you in some fashion?
Well, I think with all the things we've learned about Kayleigh's health after even after Hodgkin's. So for Hodgkin's, again, Kayleigh is cancer-free and cured from Hodgkin's, so congratulations. In chemotherapy, still has delayed side effects and complications, so we continue to see Kayleigh at least once a year going forward. And patients with Hodgkin's tend to have other risks, so as long as life will take her places and life events will happen, but as long as seeing a cancer doctor is not inconvenient, we would like her to stay in the program for survivorship. But also, Kayleigh is also seeing 2 other cancer teams, the breast cancer team, which she had, risk reduction breast mastectomies for that, which would really reduce her breast cancer substantially. And she's also following with the onc and gynecology teams for ovarian cancer surveillance and also possible plans for surgical risk reduction. So those are still moving parts. So in Kayleigh's journey with, cancer, doctors still not over with, but at least she's absolutely cured from her Hodgkin's 8 years into it now.
And we love to
Yeah.
hear that.
Yeah.
And we are rounding up baby Yakum to come out here with us here in just a moment. Last question, though, is from Pauline. What recent advances, or where are we as far as like on the horizon of advancing treatment for this or detecting it early?
Yeah, and there's been many exciting advances in Hodgkin's lymphoma and all hematological malignancies. So in broad concepts, again, we're using targeted therapy for blood cancers, and we're really shying away from chemo a lot in many of the lymphomas and blood cancers in general. There's the immune checkpoint inhibitors, which have become a standard treatment in patients with Hodgkin's, and CAR T. So again, there's definitely a lot of progress going on in clinical trials for CAR T in Hodgkin's and other B-cell lymphomas. And this has been, the last 5 to 10 years has been significantly encouraging for patients with blood cancers. We've had a lot of interesting therapies with low toxicity and high cure rate. So we're very happy that we can offer our patients much better tools.
That's always the best. Well, how'd you celebrate being cancer-free or being told that's got to be the best news ever?
It was. We all cried. Lots of tears, lots of happy tears. We had a celebration at home.
Yeah.
We went on vacation for the first time
Love
in
it.
several months, being able to finally.
I don't think it takes a lot to make this guy cry over
No.
here.
Yes, it's very wimpy.
We'll do it again.
Wimpy.
You're wimpy. Okay, we love a good wimpy guy, a sappy sap. Okay, so we're going to bring in your hubby. We got Justin. We've got Bryn, your 8-year-old. And where is baby Yakum? Do you call him Yakum, or is this just
Yes,
Dr.?
baby Yakum.
Hi.
Come on in.
Come here, Jake.
Hi.
Jake.
All right.
There you
There's
are.
How about that?
Guys, I love this. Hi, Justin. How are you?
Good, how are you?
This is just a great, fun reunion.
Yes, it is.
Good to have you. Hi, Bryn. What's going on? Good to see you, big sister. So, when's the last time you saw Jake?
Oh, I make it a point to see Jake always. And every time we see Kayleigh, and she's the only reason I see her is to keep Jake coming.
Exactly. You must bring Jake along. Okay, so Kayleigh comes home and goes, I just met with Dr. Yakum, and he's decided he's named our baby for us.
Yeah,
What'd
he
you
was
think?
with us.
You're like,
Yeah.
made it easy for you.
Yeah, it was perfect. We were struggling with names, and it was a done deal pretty quick. So.
I love that. What's this experience been like for you, Dad? Just kind of going through this, being a husband and a new father, and what have you learned from this?
It's just a roller coaster,
Yeah.
Dr. Yakum, great man, special to our family, and we just kind of leaned on our friends, leaned on our family, and all the experts, and just kind of trusted the process.
Yeah,
so.
trusting the it's not always easy to do, is it?
No.
Right.
But you're pretty powerless, so there's not much you can do.
Okay, so what's it like, just again, we asked earlier, just this honor of having one of your patients name their child after you. What's it like?
It is such a great impact. Again, it's an everlasting sensation of mutual gratitude, honestly. And I feel I impacted her life and her future, and she's impacted me same ways, and we're always going to be connected at that level.
That's a sneaky way to just connect yourself to someone. It's just to say, just name your kid after me, and now we always have to stay connected.
Yeah.
So does Jake get it, or I know when he gets older, he's going to go, who'd you name me after?
Yep.
Yeah, we've talked about it quite a bit. We've talked about, he doesn't quite understand the whole cancer thing.
Right.
But that mommy was sick when Bryn was a baby, and he's seen the pictures with, no hair and all of that. And that I was sick, and Dr. Yakum made me better. And so he's named after him.
Yeah,
right?
It's a good guy, good name,
Yeah.
good strong name.
And he comes into the cancer center, he makes his rounds, he
Yes.
says hi to everybody.
He knows everybody.
Everybody knows him. Yeah.
Yep.
He's rounded like the rest of the doctors. We love that. We just loved this story and just the ending, and it's just great. I do have a question though.
And hopefully in 20 years he'll be sitting in my
smile?
spot.
Exactly. That's where we're headed with this.
Dr. Hobbs.
So, question though for one of our viewers: were there any family members who were surprised that you named? Because they're like, okay, is this child going to be named after me? how's this going to go? And were they like,
Right.
what?
I mean, obviously, everybody would love to have a family member or a baby named after them, but no, everybody really took that in stride, just knowing the meaning and how
Yes.
special it is, and they all feel the same way about Dr. Yacoub, so just very thankful.
We love it. We love it. Just thank you so much for sharing your story with us
thank you for having
and being
us.
here with us today. It's fun. It's a happy ending, and that's really kind of what gives people hope, and that's really what it's about. So we're going to get. I really want to know what the takeaway is today. And Dr. Yacoub, I'll let you get us started. What do you want people to walk away from?
I think Justin said it best, is that this is just a wild ride, and cancer is just not common knowledge, and patients come in, they need to prepare, they need to do their due diligence, and but they also some faith in the process and the team is the best way to go forward. And you do your due diligence, and you also have to trust your treating team, and just enroll with the process. And I think the attitude, Kayleigh's attitude just was a go-getter, gotta get this done, get this completed. She handled good news and bad news absolutely positively. And she turned that into action, and eventually she got all the wonderful health results after that.
Yes.
And as physicians, we don't just treat the cancer, we treat the patient, we treat their family, we have to factor all those moving parts. And sometimes we speak about it, sometimes we don't. This is a great opportunity to actually speak about all the other moving parts in a patient's health. It's not just getting the scan to be negative. It's all of this.
Right.
Yeah.
It's not just killing the enemy, as you called the cancer. It's seeing these happy guys right here with us today, and just surrendering to the process. It's really hard to do. So kind of like what Justin was saying. But well, Justin, I'm going to let you guys talk as well. Just what do you want folks to take away from your wife's story? And just, you got a lot. Your wife's got a lot of life ahead of her, and just this whole big support team that has surrounded her. And what's that all meant to you over this time?
It's just a blessing. Like Dr. Yacoub, KU, our family, our friends, everybody just helped out with everything. And Kayleigh had such a positive attitude going through it. A couple days after chemo, she wasn't feeling well, and then she's ready to go. Like, let's get moving.
Yeah.
So I think it's just kind of that move forward, be positive. Being down about it's certainly not going to make anything better. So
yeah. Attitude's everything.
Yeah.
Kayleigh, what's the big takeaway from your story?
I would just say, nobody knows your body like you do. Listen to your body. If you think something's wrong, get it checked out. There's nothing wrong with being wrong. I mean, if it is nothing, then that's better than the worst.
That's really good advice.
Right.
Yeah. That's really good advice. All right. David, Jake,
Can you
we
wave?
get a little high five for the doc? One more high five
one more.
for the road. One for the road. All right, Bryn, thank you for coming on today.
Thank you.
Thank you guys for sharing your story. We
Thank
really
you very
appreciate
much.
it. Good to see you.
Thank
Good
you
to see
so
you.
much.
And thanks to all of our viewers for being with us and your great questions. We'll see you back here tomorrow at 8. The COVID-19 public health emergency is officially ending. Patients need to understand how to navigate that transition. I'm Jessica Lovell on the next Open Mics with Dr. Stites. The good news and bad news due to changes on the federal level. What back to normal means for patients, providers, and the future of vaccines. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.